Good afternoon, everyone. Our apologies for the delay. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province.
Thank you, Tom, and good afternoon, everyone. I want to begin by apologizing to healthcare workers who felt singled out last week as I encouraged those who were eligible to sign up for appointments this past weekend. It was not my intention to add more stress to an already stressful time, and I am sorry that my words had this impact. This is especially important to say, since given the new information about Pfizer vaccine supply decreasing over the next several weeks, and the fact that booking appointments may be more complex in the coming weeks, as options are adjusted with this new supply data information. We will need your ongoing patience as we make these adjustments. I appreciate that healthcare workers have been under tremendous pressure as COVID-19 case counts in hospital have been high over the past several months, and I want to thank you for your work. Turning to today's numbers, due to a technical issue, our website will not be updated until later today. We will post our usual dashboard of information as soon as possible. Over the last 24 hours, we have identified 474 new cases of COVID-19 and completed about 8,500 tests. The positivity rate is about 5.4%. There are currently 739 people in hospital, including 120 who have been admitted to the ICU. Sadly, 11 new deaths were reported to us in the last 24 hours. While it is encouraging to see these numbers are going down, it is important to keep in mind that over the past 10 years, the average annual recorded death toll from influenza has been 58 deaths per year. So having lost an additional 11 people to COVID-19, which amounts to almost 20% of an average full year of influenza data, should not be taken lightly. The lives lost to COVID-19 are a painful reminder to us all of the seriousness of the virus and the need to protect ourselves and each other from it. Earlier today, the Premier noted that the first dose vaccinations have been provided to residents and staff at all 357 long-term care and designated supportive living facilities in Alberta. I know that residents and families with loved ones at other facilities may be asking when they will be able to get immunized. We started with staff and residents in long-term care and designated supportive living first, as they are the most vulnerable to severe outcomes. To date, 66% of all the deaths in Alberta have been in these facilities. Vaccines are being offered to residents in mixed sites where some residents are in designated supportive living and others not, but where all residents share space and commingle. Whenever possible, the vaccine is being delivered at the same time to everyone in these facilities. However, in some cases, the vaccine is being administered in separate times due to limited vaccine supply. Alberta Health Services has been reaching out to these facilities as well as any place where someone may not have been well enough to receive the first dose immunization when they first visited. I know that many other seniors would benefit tremendously from this vaccine. We want to offer them immunization as soon as possible. Unfortunately, we will be receiving fewer doses than we had hoped for over the next few weeks. However, once supply increases, we will be able to expand access and start offering the vaccine to all seniors 75 years or older, no matter where they live. We will also be able to begin offering vaccine to persons 65 years of age and over, living in First Nations communities or Métis settlements. I know it is challenging to have to wait for this to start. While we cannot control the amount of vaccine available, we are working hard to immunize Albertans as safely and effectively as possible. I'd like to end today by noting that it's been a week since in-class learning resumed for schools in our province. As I announced last week, starting today, we are using updated terminology to classify schools with cases of COVID-19. You'll see those changes reflected in the school map online. To date, we have identified 181 cases in 133 schools since classes resumed. This number reflects community transmission not in-school transmission, and it is important to distinguish between the two. As I mentioned earlier this month, an analysis of all our cases in school-aged children in the September to December time period last year indicated that only about 6% of these cases were determined to have been acquired at school. The current school model in place is largely effective at limiting in-school transmission. However, as cases rise in the community, they also rise in school populations and everywhere else. The protocols in our schools are important as they allow our students, staff, and teachers to experience the benefit of in-person learning while limiting spread in school. The impact of community transmission is another reason that we must proceed slowly and cautiously as we consider easing the restrictions currently in place. Over the last month, we've seen active cases, hospitalizations, ICU admissions, and our transmission rate decline. This is a testament to the hard work and sacrifices of so many. At the same time, our numbers are still far higher than they were just 3 months ago. Today is January 18th. Just 3 months ago, on October 18th, our active case count was just over 3,000. Today, it's more than 12,000. Critically, on October 18th, there were 120 people in hospital with COVID-19. Today, we have more than 6 times that total. All of this means we are making progress, but we are not out of the woods yet. So as we ease the restrictions on 3 province-wide measures today, please continue to take every precaution you can and make good choices. Choices that will help reduce the spread of COVID-19, choices that will help save lives and our healthcare system, and choices that will help lead us in a direction where we may be able to safely relax more measures in the weeks ahead. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Thank you. Yes, the first call is from Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. Business owners in several industries, including restaurants and fitness studios, are using data from other jurisdictions to show that their operation has a relatively low risk of a COVID-19 outbreak. What does Alberta's industry-specific data show about the risk of indoor activities like eating at a restaurant and working out at a gym?
What we've seen in our own data is again, relative is a really good word, because what we've seen as we've evaluated all of our transmission data in the past many months, and especially wanting to note that unfortunately during the months of November and December, we weren't able to pinpoint where the majority of that transmission was coming from, so looking at data that we had before that. What we've seen is that the numbers of cases attributed to those types of environments, so again, restaurants, fitness being the 2 that you specified, are higher than the activities that we have eased open this week, effective this week. I know that there's been great interest in having a listing of all of those specific numbers, and want to make sure that we are providing that information to those industries. But what it comes down to is that we must start with our easing of restrictions by allowing those things where we have data that indicates they are the lowest likelihood of having transmission occur in those settings, and then moving on to potentially easing in other settings. And we are working with industry partners to determine how we can ensure that they are part of the discussion to plan for a staged effort when we do reach that point where we're able to consider opening other industries.
Operator, can you put through the next caller, please?
Julia Wong, Global Calgary.
Hi, Dr. Hinshaw. Are there currently enough doses to give everyone who had a first dose a second dose? And if not, what options are being explored for second doses as the province deals with delays from Pfizer? So, for instance, Quebec is extending the time between doses to 90 days. So what's the backup plan if second doses do not arrive in a timely manner?
At the moment, we are prioritizing the second doses that have already been booked. And I don't have the specific information, of course, the details on the specific amounts of vaccine that we have coming in and how those are used is being tracked very carefully and closely by Alberta Health Services. But what I can tell you is that at the moment, it does seem like we have enough vaccine in hand, as well as what's been committed even with the reductions in the Pfizer supplies, to be able to offer that second dose to all who've booked it. And of course, we will continue to monitor that very carefully. And at the moment, we do not anticipate needing to push our second dose appointments past the 42 days that we discussed last week.
Operator, could you put through the next question, please?
Carrie Tate, Globe and Mail. Carrie, your line is open.
My line is open, but I'm on mute. Sorry about that. Dr. Hinshaw, I'm wondering if, in light of the hiccup on the supply chain, whether Alberta is considering holding back doses when it resumes its vaccination program, rather than just going all first doses as quickly as possible.
I think even with the hiccup on the supply chain, what, again, we've been looking at and what we believe we're able to do is to offer second doses to those who've booked their, again, second dose when they had their first dose. So we believe even again with this unfortunate development that we will be able to honor those second dose commitments, and that the approach of making sure that Albertans have access to vaccine as quickly as possible is one that allows that opportunity for Albertans to be protected, as many as possible, as soon as possible.
Operator, could you put through the next question, please?
Thank you. Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. Thanks for taking my question. Are you able to quantify how many eligible healthcare workers have yet to receive their first dose?
I don't have that information at my fingertips, but we can take that offline and see if we have access to that information for you.
Operator, could you put through the next caller, please?
Thank you. There are no further questions in queue.
All right. Thank you for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe evening.